Let's talk about dry eyes.
So we finished our exam, and of course, you heard me mention a couple things, something called the meibomian glands, and they're a little bit, I said blocked up with my little air quotes because I learned that from one of the doctors I used to work with. Dry eyes is a condition literally that can lead from anything physical, dry, scratchy, gravelly, which of course the patient would be telling me about. There can be things that I would see in the microscope like it did on you where the eyelid doesn't look to be in perfect health or the ocular surface doesn't look to be in perfect working order, and they will affect vision as well as the physical stuff. So I don't know what the ratio is, but I've got patients that only care because they're gravelly. I got other patients that say, I've got no symptoms except every afternoon I'm at my computer and everything starts to get blurry. And then, they want to blame the glasses, the contacts. They could be powers they've worn for 5 years. I mean, there's just no change. And it's the ocular surface. So it's dry eye. Other thing that people complain about is that eyes are tearing. Well, okay, so they'll say, Doc, why are my eyes tearing? I'll say, well, because you have dry eye. And they look at you like, I just got done telling you. They think I'm slow or something. They just got done telling you that my eyes are tearing, and you're telling me they're dry. And what I'll say is the ocular surface is dry and or irritated, and it's sending a signal to your brain to say, you got to do something. And the only thing that the eye can do is produce reflex tearing. So they come from the gland up top, the lacrimal gland. Same thing, if you're tearing, upset, crying, stub your toe, that reflex mechanism is going to kick in. That's what's causing the excess tearing. Of course, now you're trying to look through that. Again, a little dramatic, but try to look through water. You can see what's across the pool, but not clearly. I mean, you can see bodies over there. You can't tell who's down at the other end if you're looking through the water. So you've got to have a premium ocular surface to have maximum vision and maximum comfort. In your case, you've got mild condition in this particular incidence, but you've got something called MGD. It's meibomian gland dysfunction. The little oil glands that line the lids, upper and lower, like little soldiers, they're getting a little bit bogged down, maybe, a little congealed. Not infected, because there's not a big knot, a big sty. You don't have this big painful bump like some people have, but those glands, they're just not flowing right. So when I still had the microscope over here in front of you and I had the little Q-tip out, I was putting a little bit of pressure on the lid, not telling you because I didn't want you to jump out of your chair, and I was checking to see how much pressure it was going to take to get these oils, these natural oils that should be released onto the surface, to just flow naturally. And not every gland, but a few of them, I had to push a little harder than I would have thought. And it's just saying, okay, look, let's take a break when we're done with the exam and we kick ourselves away from the machine. Let's talk about it. And there's different ways that we can kind of get you feeling better.